Hello everyone, I am Dr. Huang from the Eye and ENT Hospital of Fudan University in China, and thank you for giving me the opportunity to tell you about the subject, an investigation into the impact of different rose-Bengal formulations on corneal thickness and the efficacy of rose-Bengal green light cross-linking. We want to declare that we have no financial or proprietary interest in the materials presented herein. Corneal cross-linking is a main treatment to enhance the biomechanical properties of the cornea and delay the progress of keratoconus. The recent protocol involves the use of riboflavin and ultraviolet light and requires a CCT of no less than 400 micrometers after the epithelialization to keep the safe of the corneal endothelium. Rose-Bengal green light corneal cross-linking (RGX) is a promising treatment for thin corneas due to the shallow infiltration of rose-Bengal RB in the corneal stroma, since the irradiance and the total energy of light is much larger with RGX than UVX. We hypothesize that water evaporation during light exposure might lead to a decrease in the CCT, thus affecting the safety of endothelial cells. Studies to date have been limited to the use of a RB formulation comprising 0.1% RB in the phosphate buffered saline (PBS). There is a lack of commercial RB formulations. The effect of RB formulations on CCT has not yet been reported. We postulate that HPMC may be appropriate for maintaining the CCT in the process of RGX, but its effect on RGX need to be explored. The present study aims to explore the CCT changes in rapid corneas during the vivo RGX. We also examine the surgical efficiency of different RB formulations that vary in terms of their carrier solution, concentration, and installation time. We prepared different RB formulations as shown in the table. The concentration of RB in all of the prepared formulation was 0.1% weight volumes. Clean-grade male Japanese white rabbits were used in our study. Rabbits were randomly divided into 12 treatment groups, in which the right eye of each animal was treated with a different combination of the formula of the RB solution and the infiltration time, and the left eye was de-epithelialized as the untreated control group. After topical ocular superficial anesthesia, the central corneal epithelium was removed and the corneal surface of each group was completely infiltrated by the corresponding RB formulation via a corneal well for either 2 or 20 minutes. After euthanasia, central corneal buttons were stiffened and frozen sections were cut. RB fluorescence of corneal sections were photographed using a confocal microscope. The RB fluorescence were analyzed by ImageJ software. The fluorescence curves showed that HPMC did not affect the infiltration of RB. The infiltration depths were about 120 micrometers in the 2-minute groups and 200 micrometers in the 20-minute groups. Both the infiltration depths and the areas under the fluorescence versus depth curves increased significantly with the extension of infiltration time. The groups containing dextran demonstrated the minimal AUC, and thus were not included in the follow-up experiments. There was no significant difference among the other groups with the same infiltration time. After RB infiltration, the other experimental corneas were irradiated immediately with 0.25 watt green light for 600 seconds. During this time, a 30-second application of RB formulation was performed at 200 seconds and 400 seconds of irradiation, and the cornea was rinsed with PBS at the end of the irradiation procedure. CCT were measured with an ultrasound accuracy, and at the following 7 time points: before the epithelialization, after the epithelialization, after infiltration, after irradiation for 200 second, 400 second, and 600 second, and after reading. The CCT minus the CCT after de-epsilonization was recorded as delta CCT, as shown by the two figures. In all treatment groups, the CCT increased after infiltration. The hypotonic 0.1% RB group showed only a slight increase of about 30 micrometers. The other groups showed a significant increase of about 70 micrometers in the 2 minutes groups and 170 micrometers in the 20 minutes group. The CCT of all the groups decreased significantly during the first 200 seconds of irradiation, and then decreased slowly during the last 400 seconds of irradiation. The groups with HPMC concentration of 1.1% and 1.7% maintained larger CCT during irradiation than groups with other RB formulations. There was no significant CCT difference between the 2 minutes and 20 minutes infiltration protocol hypotonic 0.1% RB, and the CCT of the two hypotonic groups were both lower than that of other groups during RGX. Except for these two groups, the CCT of other formulations in the 20 minutes groups was significantly greater than 2 minutes groups during RGX. After RGX, the rapids were insulinized and the central corneal button was tryphined from each eye and digested in type 2 collagenized for corneal enzymatic resistance test. The figure shows groups of photos taken every 2 hours, as shown by these digest curves. The untreated corneals were digested most rapidly within 6 to 8 hours. The average digestion time varied from 11.5 to 14 hours in the 2-minute RGX groups, and 17 to 19.5 hours in the 20 minutes RGX groups. Overall, the digestion time of the 20 minutes groups were about 5 to 6 hours longer than the 2 minutes groups with the same formulation. There was no significant difference in the digestion time among RGX groups with the same infiltration time. After RGX, the animals were insulinized and the central vertical corneal strips were cut and placed in an universal testing. After 3 pre-cycles, the strips were stretched to 20% deformation. The stress strain curves were drawn, and the Young's modulus at different strains were calculated. The figure showed the Young's modulus of corneal strips at different strains. At 10% strain, the untreated group had the smallest average Young's modulus of 18.95 MPa. The 0.1% RB-PBS 2 minutes group, 0.1% RB-PBS 20 minutes group, and 1.1% HPMC to 0.1% RB 20 minutes groups. Young modulus were 1.72, 2.1, and 2.04 folds of untreated groups respectively. 0.1% RB-PBS 2 minutes was significantly lower than that of 0.1% RB to PBS 20 minutes and 0.1% RB to 1.1% HPMC 20 minutes. There was no significant difference in Young's modulus between the last two groups. According to the present study, we conclude that in RGX, the CCT increased after infiltration but decreased significantly during irradiation, especially over the first 200 seconds. The addition of HPMC in the RB formulation slowed down the reduction of CCT during RGX without affecting either the infiltration of RB into the cornea or the cross-linking effect. We propose that 0.1% RB to 1.1% HPMC infiltration for 20 minutes RGX is likely to have a considerable potential for future clinical applications. Thank you.